Good afternoon, judges. We're Team 18. Myself, Leonardo, and my colleague Sarah will do the BRAINFUSE oral presentation titled When Interprofessionalism Equals High Quality Care. All right. So the outline is the case analysis, an impression part, strengths and weaknesses, solutions, and the time for the Q&As. The case analysis. Sierra is an 18-year-old African-American female assignated male at birth, known for asthma, food dysphoria, and dysphagia, and previous muscular injuries, who presents to the BRAINFUSE Health Center for a 4-week history of persistent right wrist pain refractory to ibuprofen. Sierra's pain is dull and constant, 5 of 10 in Sierra's pain scale. Words of movement, no alleviating factors, no reported paresthesia, impact on ADL, inability to hold the pen with right hand and decreased concentration. Sierra is first reluctant to tell the reason behind her pain. Upon further questioning, she disclosed previous physical violence episodes from her mother's boyfriend, Tom. Sierra was referred to PT and OT with little improvement, and she stopped going to her PT's appointment. About the domestic situation and other important information, Sierra's parents have been separated for 3 years ago. She reports multiple episodes of domestic violence where Tom, her mother's current boyfriend, grab and twist her wrist and arm. She states that her anxiety increases when she's at her mother's house. Of note, her physical therapist does not believe in this domestic violence, and her mother belittles it. The medications Sierra is taking are the ones stated in the clinical presentation document. We want to say that the social history, Sierra have missed appointments with the nutritionist and SLP because of transportation issues. Our impressions are, these are the major health problems that need to be tackled. The wrist pain, we have a differential diagnosis of severe wrist sprain, wrist fracture, and carpal tunnel syndrome. We have uncontrolled asthma, food dysphoria and dysphagia associated with weight loss, domestic violence victim, and she's been developing anxiety and mental issues that may be caused by Tom's verbal and physical violence.
So now, before we go on to our solutions and management plan, we first want to address the weaknesses and strengths of Sierra's interprofessional team. So in terms of weaknesses, there's a blatant lack of communication between the different healthcare professionals. In fact, they don't hold any formal meetings to talk about Sierra's care, but on top of that, it seems like there are very few chart notations, and the chart notations that exist are incomplete. This is inconvenient because it results in a great lack of follow-up and collaboration in the team. Second, Sierra herself and her family members, including her mother and her father, were excluded from the team of care. Even though she's an adult, they still both represent relevant sources of information in regard to her state of health, both physical and mental, especially since we know that Sierra is a victim of domestic violence at her mother's house. And finally, the interprofessional team lacks a pharmacist who would be able to adjust or change her medication according to the side effects that she experiences. In terms of strength, Sierra is very lucky to have a team composed of diverse healthcare professionals, which allows for targeted expert care for each of her healthcare conditions. So now let's discuss our management plan for Sierra. First, here's a list of physical tests, blood tests, and imaging that we would like to order to further look into the issues and to rule out any other identifiable causes. These are the same that we wrote in our written summary. Now let's go further into details. For her wrist pain, we would like to make a consultation with a specialist, such as an orthopedic surgeon or a physiatrist, to determine the exact physiological cause. For instance, is it a severe sprain that is causing her pain? Is it a fracture? And so on and on. Once we determine the exact cause, we will be able to treat it specifically, whether by physical therapy, pharmacotherapy, or surgery. Meanwhile, we think that it is of crucial importance that she resumes her appointments to the PT and the OT to help her regain progressive function of her hand. Details of the OT treatment is already written in the written summary. For the pain, it may be possible that she has developed some ibuprofen tolerance. For that reason, we think that the pharmacist should be consulted to see if it's possible to switch for another NSAID or for another analgesic by following the World Health Organization analgesic ladder. Now for her uncontrolled asthma, we recommend that the dose of her medication be increased or that another medication should be added to control it. We think that it should be discussed between the family physician and the pharmacist, who will both follow the evidence-based stepwise approach to asthma management while preventing side effects as much as possible. Now let's go on to her food dysphoria and dysphagia. For that, we recommend a consultation to a mental health professional, whether a psychologist or a psychiatrist if needed, who will be able to evaluate if the underlying cause is of psychological nature. Depending on their expert point of view, if they think that this is the reason, if there's a psychological nature to it, they could prescribe therapy or anxiolytics. And in order to correct the underweight status that accompanies her food dysphagia, we think that the nutritionist will play a great role in helping her regain a healthy weight by building a nutrition plan incorporating proteins and carbohydrates. Finally, upon questioning Sierra, she has divulged a situation where Tom, her current mother's boyfriend, would be physically and verbally violent toward her. And we think that as a team, it is very primordial that the social worker be involved in the team to ensure Sierra's safety and her mother's safety. So before we finish, we would like to address solution we have to enhance the collaboration between the members of the caring team. We have 3 recommendations. The first one, we think that the team should hold meetings in person or via teleconference to discuss Sierra's case. The second recommendation would be that all healthcare professionals do complete charting. And finally, we think that if she consents, Sierra consents, she herself and her parents should be included in the interprofessional team so that the discussed management plans and decisions are parallel to Sierra's and her family's needs and desires. So this is all for us. If you have any questions, we will be more than happy to answer them, and the details are in the written summary.
Thank you very much, team, and for the great presentation. Now I would like to give the floor to our panel to open the space for questions and answers. Starting with the first question, who wants to break the ice?
Thank you. I'll break the ice. Thank you very much for your presentation. I particularly enjoyed seeing your good understanding of the roles of the different professionals in the team. I would just like to ask how, if you can go back to your slide about the strengths and weaknesses.
Okay, got it. There you go.
Okay, thank you. In the future, if your recommendations are incorporated regarding communication between the different team members, how else do you envisage building on that to ensure further strengths and really get the best patient holistic care? Thank you.
I don't know if somebody wants to answer that.
Yeah, you can go if you want.
Could you just repeat the question? There's a few words that I missed. If it doesn't.
Sorry, let me just unmute. So I wanted to know if you, because this was presented at the beginning regarding the strengths, and you only highlighted one of the strengths in terms of there being a diversity of healthcare professionals. So I'm wondering when the recommendations get implemented in terms of the interprofessional team and how they work together in a collaborative way, what other strengths do you envisage coming forth to ensure the best patient care for herself as well as her family?
I think that if the communication is increased between the healthcare professionals, I think one of the great strengths that will come out of that is that there will be a greater a trusting relationship between the patient and her family and the treating team. Because, for instance, we saw that because the PT was not aware of the domestic violence situation that Sierra was experiencing at home, she told her, "I don't believe in what you said," and that's the reason why Sierra stopped going to her PT appointments, and that directly affected her state of health. So I think that just by increasing communication and making sure that everyone in the team is aware of all facets of her care, including her social history, that would directly and indirectly increase her health outcomes.
Thank you. That's great.
Thank you very much for this well-articulated presentation. I enjoyed listening to it. Just following on from Dr. Helga's question, let's say the interprofessional collaboration has improved, and let's say we are 2 or 3 months down the line. What other strength would you add? So at the moment you have diversity of healthcare professionals. So what other strength would you like to see added into the slide?
Well, I can say that when we said diversity of health professional is good, but we can take it as separate. If we're 3 months down the line and Sierra's getting better and everything, we can say that we have like a team. We have an understanding of different people who's trying to do their work and get this patient better. So we get to know how, even though it's not their current, for example, if an OT and a medical professional work together, they can get understanding in both different subjects and aim to better improvement on the patient. So I think another strength that we can put there is that the professionals work as a team.
Mm-hmm. And you've mentioned lack of pharmacists in the team. Is there any other healthcare professionals that are lacking within Sierra's case?
Maybe we read something in the summary. They said she had a health behavioral healthcare professional. We weren't sure of that, but we didn't know if that included a social worker. But if that didn't include a social worker, that would be very crucial. Like we said, that this professional be added in the team, because we know that the pain that she experiences is probably coming from her domestic situation, and that's we should go at the source of the pain to prevent any further or any recurrent episodes of that.
Team, I think this was an interesting presentation, and well done for actually pointing out the challenges that the then interprofessional team was lacking. And I was particularly impressed on that point where you're stressing the lack of inclusion of the mother and the father in the healthcare team. I think that is a very crucial point that we lack in our modern healthcare. Now, how do you see the role of the mother and the father and that of Sierra in this particular interprofessional team, taking into consideration that usually professionals have a little bit of more power over the patients that they're working with? How do you see, what's your perception of Sierra's mother, father, and her role in this type of a team?
Well, Sierra stated in the clinical presentation that she's more, she likes to be with her father. So we would think that her father is a person that she can trust. Her mother, since she started dating Tom, has been a little more away. But I think that that's the main idea that we said, that they must include them, because we want to gain again that trust that Sierra had before everything happened before they separated. And as you said, most likely the health care professionals will have more, how you said, more power. But this is a joint group, and we try to get this patient better. So putting differences aside, we can achieve something greater, and learn from different areas, like in the house, like from the parents, and in the hospital from the medical professionals.
And I think one of the points of including Sierra and her team is basically just asking her what makes her comfortable. It's not the team versus Sierra, or the team working for Sierra. It's the team working with Sierra to know the decisions that we make, the management plan. Is she comfortable with it? Is there anything that makes her not wanting to take any form of treatment? And it would be important also to include her mother, because her mother is one. Okay, time's up.
You can finish your answer.
Okay, so including her mother, because we know that Sierra is a victim of domestic violence when she is at her mother's house. So it would be greatly important to ask her mother about anything that to assess the situation by asking the mother what's happening, also asking the father. And of course, when we the social worker will make a decision if Sierra is going to stay at her mother's house, and so on and on, many decisions, we should also ask the mother's opinion. That goes without saying.
Well done.